So one of the questions that we get a lot is, do I qualify for a weight loss program? And so before we start any kind of a program, we need to know, is this person overweight, or are they obese, or do they qualify at all? And so what we'll talk about now is what qualifies a person as being overweight or obese. So the Obesity Medicine Association gives us a lengthy definition of obesity. The American Medical Association has now defined obesity as a disease process and not just the result of eating too much or not exercising enough. As you can see from this definition, obesity is a chronic disease, and it is very complicated and is caused by several different things. Obesity also is a disease that causes other diseases. There are several health consequences that stem from being overweight or obese. The body mass index, or the BMI, is one of our most frequently used tools for diagnosing obesity. It is a simple calculation of taking the person's weight and dividing it by their height squared. As you can see, there are several different categories of obesity. We can start at the BMI of 18 to 24.9, and that's the normal weight. 24 to 29.9 is considered overweight, and anything of a BMI of 30 or greater is considered obesity. When we get into the greater than 40 range, that is where we see a lot more complications with diabetes and blood pressure and other comorbidities. But the BMI is a general tool. It's not always accurate. If you have someone who's a bodybuilder, they're going to have a lot of muscle mass, and they may weigh more because of that, and that could drive their BMI up, but that doesn't necessarily mean that they're overweight or obese. The cutoff for obesity, or the definition of obesity, also likely varies between races and ethnicities. The Asian population has a higher risk for getting diabetes at a lower BMI than, say, a Caucasian population would, so we have to take that into account as well. These differences also likely vary between men and women. So it's not a perfect tool, but it is easy to measure, and it is something that we use quite frequently. Waist circumference is another measure that we use to determine abdominal obesity. It's really important to find out if a person has what we call abdominal obesity. This is where you carry more of that fat tissue in the abdominal area. The reason this is so important is because that fat tissue can actually deposit on the organs, on the pancreas and the liver and the heart and all the other organs in the abdominal cavity and chest wall cavity. And that can lead to a lot of other complications, heart disease and liver disease and diabetes and all of those issues. We usually have a cutoff for 40 inches or more for a male or 35 inches or more for a female to determine if they have abdominal obesity. So sometimes you can even have a person with a normal BMI or an overweight BMI who falls into the obesity category based on their waist circumference. The next measure that we have is called the percent body fat. This one is a little bit harder to measure. There are some techniques that are less accurate. One of them is calipers that you may have seen from having a personal trainer. There are other ways of underwater weighing, and there's bone density scans machines called the DEXA that also can be calibrated to determine your percent body fat. An MRI is also a very good way of determining this, but a lot of these are very expensive and are not very frequently used. So you can see here the different percent body fat ranges. When you get into the greater than 32% for women or greater than 25% for men, that's considered obesity. So obesity is itself a disease, and it also causes diseases. And one of the terms that we use for obesity is called sick fat disease. And this is how the fat tissue itself actually releases certain chemicals and hormones in the body that cause some metabolic changes within the body and can lead to several of these diseases. And so some of the common ones that we see a lot are diabetes, elevated cholesterol, high blood pressure, but some of the things that people don't think about are things like gallstones or asthma, infertility. Of course, there's an increased risk for heart attack and stroke as well. And then we get into some of the other diseases that are caused from the actual weight and bulk of the fat tissue. When you have an excess of fat tissue, it can press on organs, it can press on blood vessels. The extra weight is wearing down on the back and the knees. And so then we get things like osteoarthritis of the knees and the back, a lot of back pain, things like acid reflux and shortness of breath. And then obstructive sleep apnea is another one that we see quite frequently because of the extra weight on the neck and the chest while you're sleeping can obstruct the airway and can lead to some issues with that. So as you can see, obesity is very complex and there are many different things involved in it, and so it's good to have a professional who knows a little bit more about the details of obesity when seeking to lose some weight and treat this disease.